Hello again. Today, this is my 5th day of taking Cannimed CBD Oil 1 to 20 mixture with THC to CBD. And I was prescribed this here in Grand Cayman, Cayman Islands for chronic pain. As I've shared in previous videos, I've contended with daily chronic pain for 7.5 years now. Secondary to getting hit by a semi-truck on the expressway at nearly 65 miles per hour. I have gone without any prescription pain medicine, including opiates and NSAIDs, for now 6.5 years due to negative side effects and having children and choosing to breastfeed. So yesterday I took the 7th dose, and I increased it from 0.5 milligrams, which is the same as 0.5 milliliters. I increased it as I was instructed that I could do, up to 1 milliliter, and I took that just around noon. Then yesterday I took my 8th dose of Cannimed just before midnight, and I did the 1 milliliter again, but I broke it up into 2.5 milliliters, and I took it back to back just so that it made it easier to absorb, because I found that in the first dose that I took yesterday that it was too much oil sitting underneath my tongue. I think I swallowed more of it than what actually absorbed. So I want to make sure that I get the maximum benefit of taking this oil. So I am now going to take the 9th dose, and it's just about 12:45 here in Grand Cayman, and I'm obviously getting started really late. So I just kind of take life as it comes these days. So yesterday I started to break down my pain based on region, and I spoke about the pain that I experience in my hands. And my hands are painful, and it affects things like holding hands with my husband. So obviously that affects intimacy within a marriage. It affects holding my little one's hands. So some days they hurt too bad to do that, and it shouldn't hurt to hold somebody's hand. So that's likely due to Ehlers-Danlos syndrome, and I have the hypermobility type. I've researched, and I'm in different groups with other people with Ehlers-Danlos, and groups with doctors specifically that have Ehlers-Danlos, and that has been a common complaint of pain in the hands. So I think that that's where that originates from, considering the fact that I have dealt with that from the time that I was a little girl, and then it got worse with age. Today I want to talk about the pain and the quality of pain that I experience in my upper back. And this pain, it radiates up through my neck, into my head, and into the frontal part of my forehead. So I tend to get debilitating frontal lobe headaches that will put me in bed. And in addition to that, that'll make me more sensitive to light also. So that pain started after my car accident. I never experienced that prior to my car accident. And the best way I can describe it, up in here, it feels raised. It feels like I describe it as like a Play-Doh feeling, and I get this dull burning sensation. I did have an EMG done of my upper back after my accident before we moved here when I was still living in Michigan, and it did show radiculopathy in my upper back region. So I haven't had an EMG since then, so I don't know what it would show now, but it feels thick. And I also have what we call in osteopathic medicine tissue texture abnormalities. I had trigger point injections just a couple weeks after my accident, and I was so inflamed that the rehabilitation doctor couldn't, the needle that he was using wouldn't even advance into my tissue. That's how inflamed my body was at that time. So it's a dull, burning, thick Play-Doh feeling in my upper back. And I've experienced this now for 7.5 years. And I'll also, like, for the last couple weeks, I had one area where there was a tissue texture abnormality. It was a tender spot. It was more of a sharp pain that was really affecting everything that I did, because I could do even less with that pain. Like when I would move my head and my neck, that would bother me more. So when I think about what makes it worse, we've had a good amount of rain recently. Rain and the change in the barometric pressure, that always affects my upper back and really my whole body and all of the pain regions that I deal with. Rain definitely affects it. Before moving to Grand Cayman, living in Michigan with a cold climate, that put me in bed for 7 months out of the year. And being in your early 30s, that's not quality of life. That is good. That's not even a good quality of life for somebody in their late 90s. It is miserable to be in pain every day. And that's one thing that I'm grateful for here in Grand Cayman is the climate. Even though I still hurt most days, I still get out of bed with my children, and I can be a better mom because of a choice that I made to move to a warmer climate. And that's not easy. I understand that not everybody will do that. I actually told my therapist back in Michigan, I was like, you should tell your patients to move to a warmer climate for pain. He's like, Nicole, I won't have any patients left. And so it was a reality. So it's the cold weather affects me. My menstrual cycle, I always experience increased pain while I have that hormonal fluctuation. And overuse, if I do too much. Like I said, if I have a good day, I naturally want to do more. I want to live my life, but then I end up suffering more. Things that make it better: heat helps, therapeutic massage from somebody who is aware of anatomy and physiology, not just like a light touch, somebody who actually understands the neuromusculoskeletal system. That has been effective for me. The electrical stimulation that my chiropractor uses, I notice temporary relief from that, so I want to continue using that. I have a couple notes written down just so that I don't miss anything. Rest makes it ease up, and pregnancy. My pain during pregnancy, because of the increase in progesterone, my pain up until towards the end of my pregnancy, when I was just bigger because of the pregnancy, I actually felt better with the increase in progesterone. Progesterone acts almost as a natural painkiller. So does oxytocin. So breastfeeding has natural pain relief benefits. So thanks to my son for breastfeeding for 4 years, and my daughter is 2, turning 3 in August, and she still breastfeeds. So they've been a blessing in more than one way. And they have benefited greatly from breastfeeding, and my body naturally gets some added pain relief from the oxytocin that is released during breastfeeding. I was also told by my rehabilitation specialist that that is also a common key finding in somebody with Ehlers-Danlos, is that they do better, their pain is better during pregnancy. Unfortunately, after having childbirth, it is a completely different story, and I will talk about that more tomorrow, because I experienced an increase, disheartening amount of lower back pain after having both of my children once the hormones re-equilibrated. So some of the treatment that I've had on my upper back, I talked about the trigger point injections. I had ultrasound done on my upper back, but I didn't experience any notable difference from that. I've had extensive physical therapy both in Michigan and here in Grand Cayman. I have the electrical stimulation, the therapeutic massage. I've had different types of acupuncture, and that never provided me personally any relief. I know that other people speak very highly of acupuncture, but for me it didn't do anything. I had dry needling done by a chiropractor that I saw here before going to my current chiropractor, and that was incredibly painful for me, and it did more harm than anything. And for someone like me, I just would not recommend that at all. Essential oil lotions have been used on me. I know people love their essential oils. I know they have their place, but for my quality of pain, it's done nothing for me other than it smells good. So there's been no notable effect for that. Other things that make, a couple more points, other things that make my upper back pain worse is extension of my neck. So for example, since my accident, like going to church, I can't sit in the front because it puts my neck into extension and I am in miserable pain. I can't do it. I always choose to sit in the back so that I'm not extending my neck so much. And just sitting for extended periods of time for me. Like right now I'm already burning in my upper back region, and I actually created a little diagram. I don't know how well it will show up on the video, but this is me. And you're looking at me from behind, so here is the left side and here is the right side. So this is the region, this is that dull, burning, thick Play-Doh feeling area that radiates up into my head, into the frontal lobe, giving me those headaches. So it is pretty miserable. And then recently, let me see, right, left, just recently, the last couple of weeks, I've had this terrible tissue texture abnormality right here that's really painful if I touch. And I also get these bands of tissue, and they feel like rolly bands of thick tissue, and it's miserable, and it just doesn't ever relax. I remember even telling the physical medicine rehabilitation doctor that tried to do the trigger point injections in my back, like, I wish I could just like inject something and it would like deflate a tire, because that's what it feels like would give me relief. So I think that does a pretty good job of explaining the region of my upper back, which radiates up through my neck and into my head. So I am going to take the next dose of Cannimed, and this is my 9th dose now, and I am going to do the full 1 milliliter allotment that I'm allowed to take. My hands, I couldn't get a peanut butter jar open this morning, so thankfully I have my husband to help me out. He has been instrumental since my accident. Granted, we haven't had an easy marriage. My accident happened 2 weeks after we were married, so I got the for sicker and the for worse, and then he had his own set of issues. We definitely haven't had it easy, but we have grown so much through our marriage with the help of faith, patience, and a lot of forgiveness and grace, which is greater than both of us. And hopefully that inspires someone else today too to have hope. So anyway, I I'm going to do the 0.5 milliliter and then the other 0.5 milliliter again today. And as I've shared before, you put it under your tongue, and I've been having a hard time pushing this thing, it gets stuck. And then you let it absorb. I shouldn't talk. It's a lot easier to do this based into 2.5 milliliters than to take the full 1 milliliter. And I really shouldn't talk when I do that. So tomorrow I plan on moving down to the next region of pain that I experience, and that's in my lower back region. And then the next day I'll talk about the pain that I experience that is sciatic in nature, then it extends down my leg into my foot, and how that affects my daily life. So thank you for listening. If this helps you, one woman told me that through listening to these videos, she said she's been so sick of being on pills that have not done anything positive for her. And she stated that watching these videos helped her in terms of encouraging her to seek out more natural options like CBD oil. So that's exciting for me. I hope that these videos continue to show others that there may be a different option for them that may provide relief to them. I also have a friend, he's a doctor in India. He used to be a neighbor of ours here in Grand Cayman, and he shared that he would be sharing these videos with colleagues of his in India. So that is exciting too. So it's nice to see that my journey, as painful as it has been, it's serving others along their journey too, because that's what life's all about, having a servant's heart. So thank you for listening, and I will come back and do another video tomorrow, and I hope it serves you well. If it did, please share it, please like it, so other people can possibly gain benefit from it too. Have a wonderful day. Bye.